Many people are hurting. The middle class is shrinking. Some people are losing their health insurance. Others are losing their homes. Food supplies are decreasing. Some individuals cannot afford the cost of food today as they continue to rise. The demand for our social service continue to increase. And many individuals are moving their kids out of private schools into public schools. The bottom line, Mr. Speaker, many are suffering and need urgent help. Mr. Speaker, when one reviews internationally today, one of the greatest causes of bankruptcy, today is health-related illnesses. Illness is the greatest cause of bankruptcy today. And with that, is the greatest cause of individuals experiencing all the problems that I mentioned in terms of having to move their kids out of school. This is not a guesswork, Mr. Speaker. The greatest factor to cause those problems today is illness. And if you imagine a small businessman who has a business, an insurance, and he employs 10 individuals, if you imagine that that individual became ill, required hospitalization, his insurance can be utilized, and as a result of that, he himself cannot work, cannot run his small business. As a result, the business subsequently collapses because of health, illness. Individuals become unemployed because of his illness. But that's the commonest cause of the problems we see in the financial world today. And when one looks at the particular illness, if we try to isolate the particular illness that is most accountable for the problems, bankruptcy, poverty, shrinking of the middle class, the particular illness that accounts for most of that is chronic non-communicable diseases. And it's my job, Mr. Speaker, as Minister of Health, to ensure that our nation and our citizens remain healthy. It is my job to keep the nation healthy so as to avoid the problems that I've mentioned, so as to avoid bankruptcy, so as to avoid the shrinking of the middle class, and so as to avoid individuals experiencing the stress with the school systems that we may have. Mr. Speaker, a perfect example of this, if we were to look at Asia and review the economic situation in Asia between 1965 and 1990. And Asia experienced an economic boom. And the reason for that economic boom was because it was a direct impact on the improvement of their healthcare system. Their healthcare delivery system improved. As a result of that, the productivity of their citizens subsequently improved. And between 65 and 90, as they improved their healthcare system, the Asian countries became one of the most dominant today. And therefore, Mr. Speaker, it's essential that here, as Minister of Health, I too must introduce or have an excellent healthcare system to protect our citizens, improve our productivity, and subsequently improve our financial status and improve our country as the time passes. Mr. Speaker, this is why it is so important that we introduce the National Drug Plan that we spoke about that would deal with 11 chronic non-communicable diseases. But what is most important, Mr. Speaker, is this plan deals not only with medication, but the plan deals with a preventative component. And prevention applies not only to medicine, but prevention applies to all aspects of the universe, even with crime. the most important aspect of crime is prevention, not catching a criminal. With anything that we think about, the most important aspect is prevention. And Mr. Speaker, this plan would provide medication for patients, and patients would be able to obtain their medication not only in the public sector, but they would be able to enter any of the private participating pharmacy and receive that medication. And therefore, the problems that we face today, we hear individuals complaining about waiting lines or whatever, that should not happen again. Because we recognize that we do not have sufficient pharmacists within the public institution, but by dispersing and sending our patients into the private sector, we are now utilizing the private pharmacies that are out there. Mr. Speaker, as we speak about prevention, the only message I send out to the insurance company, there are many individuals who are looking after their health and doing as best as they can in terms of exercising, healthy living, healthy lifestyles, etc. And they may be registered with health associations or health clubs. And like is done in some parts of the world, I think it's time that our insurance company offers some form of discount for individuals who engage or is registered with some gym or registered with some health club or health association, because that is a part of prevention, and all insurance companies as well as government and everybody should be encouraging prevention. Mr. Speaker, the Bahamian public do not want to hear from me as to how many clinic roofs that I fixed or repaired. They do not want to hear how many new bathrooms or bathrooms that I repaired in the clinics or I've replaced. They do not want to hear, Mr. Speaker, whether I have a program to ensure that the land, the property around the clinic is properly landscaped. They do not want to hear how many doctors I've hired. The Bahamian public do not want to hear how many nurses I've hired or how many security guards that I've employed. They do not want to hear from me, Mr. Speaker, that our HIV patients are all receiving proper medication and in keeping with the Millennium Development Goals. Nor do they want to hear from me that our surveillance program throughout the Bahamas is working well so as to prevent the malaria problems that we've experienced in the past, so as to prevent the malaria from being introduced into our country, which subsequently helps to protect our tourist industry. No, Mr. Speaker, the Bahamian public do not want to hear that. The Bahamian public do not want to hear from me that our surveillance program is producing excellent results so as to prevent tuberculosis from spreading in our shores, and we maintain the tuberculosis level below 50. They do not want to hear that, Mr. Speaker, because they feel that that's my job, and I should not be informing them about repairs here or there. But what they do want to hear, Mr. Speaker, is why when they enter one of our clinics, they enter the clinic at 8 o'clock in the morning, only to be told that the doctor arrives at 10 and leaves at 11. That's what they want to hear. What am I going to do about that? They want to hear why. They want to hear why. When an elderly patient sits in the waiting room in the clinic from 9 o'clock up until 12 o'clock, who has had nothing to eat, nothing to drink, the doctor came in and left without that patient being seen. What they want to hear, Mr. Speaker, is why, when they enter the clinic at 9 o'clock in the morning and the numbering system is being given, and just at 11:30, they're told that there are no more numbers being given, and they've waited all day. That's what they want to hear, Mr. Speaker. The Bahamian public want to hear from me why in the clinics, the clinic managers do not record or